The radial nerve, part 4, we're almost there. Okay, so let's go and quickly review important anatomy that we already know about the radial nerve, and let's use the chart that will be quite helpful to help us navigate. Radial nerve is coming as the largest branch of the brachial plexus, and its origin is the posterior cord. The posterior cord, as you remember it, was made by a union of three posterior divisions of the superior, middle, and inferior trunks of the brachial plexus, so we're not surprised to see full content fibers from C5 all the way down to T1. Once the nerve runs through the armpit, it is on its way towards posterior side of the arm because it needs to cross posterior to humerus, and that is where it's going to create even a landmark on the back side of the humerus sulcus nervi radialis. Once again, I apologize, this is not sulcus nervi ulnaris. Maybe I could write it down here for the record. So sulcus nervi radialis, and that will make this chart now being fully accurate. Passing between heads of the triceps brachii, that is between medial and lateral head, will put the nerve to be in some kind of awkward position with fractures of the mid part of the humeral shaft regularly and frequently could affect the radial nerve at its main trunk, resulting in pretty significant nervous system impairment. If we don't talk about any kind of injuries, but rather we talk about intact radial nerve, within the posterior arm, it will innervate both muscles that are there, the triceps brachii, as well as anconeus, both of them being elbow extensors. And then it will keep passing or onto the lateral side. It will be partly hidden by the brachioradialis muscle, and then the radial nerve splits into its superficial and deep branch. The superficial branch remains subcutaneous, therefore takes the role of sensory, while the deep branch will take care of remaining 11 muscles, 6 in the superficial, 5 in the deep compartment of the posterior forearm. So the nerve really has quite significant list of responsibilities, innervating a total of 13 different muscles. Within its sensory domain, it would innervate the skin on the posterior side of the arm, posterior side of the forearm, and to some extent posterior hand. But when we take a look at the images from the Nether's Atlas, it will be a little bit more direct and clear. So let us explain this nerve with the help of proper imaging. So let's take a look at the first picture, which right away wants to illustrate it from a posterior direction. There is no interest for us to look back into armpit, because even if we do, we know this comes from the posterior cord, which is covered by axillary artery. That's why it's given a name. But the nerve itself will manage to get out of the axilla, and it will pass inferior to teres major muscle. At that point, it runs parallel but slightly behind humerus, and you can see here its main trunk runs diagonally across the middle shaft of the humerus. That is what we call either spiral groove, or we can call it sulcus nervi radialis. At this point here, we're losing the contact with the radial nerve's main trunk. Here is the brachioradialis muscle. This label, you can also have another label of brachioradialis. Sorry, this is brachialis, brachioradialis that are covering it. And of course, then we would have best interest to eventually see it on the next diagram, where the brachioradialis muscle is cut at the very top. And of course, now we can see the main trunk of the radial nerve and its division, superficial branch, deep branch. So the deep branch is the one which is illustrated. Number of superficial muscles of the posterior arm were cut so that we can see direction of the deep branch of the radial nerve. But also what is quite nice here is that you see those individual peripheral terminal fibers as they're entering individually bellies of muscles that the radial nerve must innervate. Although we have lost the contact with the superficial branch of the radial nerve at the top of the diagram, we're going to start seeing it practically in the middle of the diagram where it finally appeared for us, subcutaneous, and as it crosses on the lateral side of the wrist, it is splitting into multiple branches. What you see here is that these branches practically go and cover dorsal aspect of the palm. You can see here a branch going into the thumb, another branch for the dorsal side of the thumb, branches for dorsal side of index, middle finger, and the radial side of the ring finger. So let's not forget, ulnar nerve already innervated this patch of skin on the dorsal side of the hand. It innervated fully little finger as well as ulnar side of the ring finger. So on the next picture, we're going to see what shaded area in red color identifies as innervation done by the radial nerve. You recognize that there are names for these individual branches: inferior lateral cutaneous, posterior cutaneous nerve of the arm, posterior cutaneous nerve of the forearm, and mostly we need to see here what's going on with the dorsum of the hand. I will zoom in to make it a little bit easier for us to see. Dorsum of the hand is illustrated, and we have a little bit of covering for the thumb, for index, for middle finger, for radial half of the ring finger, but fingertips are left blank. Fingertips, thumb, index, middle finger, and the radial side of the ring finger. That is innervation by median nerve. So there is something that you would say is quite significant area of the skin, but I dare to make a little amendment and to inform you about this. Although we would say this part of my hand all the way to here for the thumb, all the way to here for index, all the way here to middle, and this side of ring finger, but excluding distal phalanx, that should be a radial nerve. Yes, it should be a radial nerve, but both median and ulnar nerve with their branches tend to overlap, so it is not the crystal clear cut between what is innervated by radial, what by median, what by ulnar nerve. So we have one unique part on the back side of the hand. It is patch of skin which is in between second and first metacarpal bone. So practically the wedge-shaped space between first, second metacarpals, that patch of skin is exclusively done by radial nerve. No other peripheral nerves are overlapping. And perhaps this is also good to know because the rest of the hand may not give you as exact picture as you want to find, but exploring sensation in this part of the hand might very directly point to what is radial nerve issues or some kind of damage. For ulnar and for median nerve, we used to have those infamous ape or claw hand deformities. So question is, do we have something that is uniquely related to the radial nerve? Yes, we do have it. It is also known under a quite colloquial term as Saturday night palsy. So what it means, I really don't like to advertise, but essentially it is this. Sleeping on the back of a chair, so I will just try to rotate my chair and I position myself like this. I hope you can see the back of my chair. So if I'm spending some time while leaning with the back of my arm against something that's quite firm, quite inflexible. And if I take a little nap and place my head on the top of my arm, basically direct compression against the main trunk of the radial nerve may happen. So upon waking, I would find out that nerve practically has gone asleep and that I would have very limited voluntary movement on the back side of my forearm. And that is something that is typically in the clinic related as the wrist drop, inability to produce active extension at the wrist, which is also combined with inability to extend the fingers. So the Saturday night palsy might be just temporary depending for how long this person has been sleeping in their own arm. The nerve goes asleep because we interrupt its internal blood supply, and therefore we would need some time for blood supply to become restored, reestablished, in order to start feeling improvement, and of course then the nerve starts functioning, including extension of the wrist or extensor muscles of our fingers. If the worst case scenario is considered, that some kind of really complicated fracture against the middle part of the humerus is involved, it is quite close to the main trunk of the radial nerve. As a result of this fracture, which could be looking like ordinary fracture without displacement of fractured segments, basically the local area bleeding could form a bit of hematoma around the main trunk of the radial nerve as it passes posterior to humerus. Blood will start coagulating, and the coagulum will be slowly producing a little bit of a squeeze on the main trunk of the radial nerve. Although the patient could be placed in a cast, sent home, basically it should have never been done without specific instructions and warning. The cast will always leave fingers free to move, and the patient should be told to monitor if they have any difficulties in finger extension. If the cast is just proximal to wrist, patient could be instructed also to actively extend the wrist. If they can't do it, that is sure sign that a radial nerve has been compressed and some additional treatment must be done in order to preserve it. And while preserving the nerve, of course, we will be preserving function of quite a large number of muscles. So I appreciate your watching this fourth video in a series about brachial plexus major branches. Stay tuned for the last one. The last one certainly has to be the axillary nerve, and along with the axillary nerve, you and I will be talking about dermatomes of the upper limb. So I hope you like this video. If you did like it, please acknowledge it, put that little thumb up. I always appreciate, and if you haven't done so far, please subscribe to Anatomy Made Simple by Dr. T. Stay tuned and look for the axillary nerve short video. Thanks for watching this one.